State Department of Education, Aid to Education. Catherine Barber is our analyst, and Dr. Carrie Wright is our State Superintendent of Schools. Welcome. Go ahead.
For the record, my name is Catherine Barber, and today I'll be presenting the DLS budget analysis for MSDE's Aid to Education budget in fiscal 27. The fiscal 27 budget for Aid to Education increases by $271 million, or 2.5%, to $11.1 billion after accounting for approximately $56 million in proposed fiscal 26 deficiency appropriations and $41 million in fiscal 27 contingent reductions. On pages 6 through 11, you'll see a number of exhibits presenting data on math scores and English and Language Arts, or ELA scores, from the Maryland Comprehensive Assessment Program, or MCAP. Scores are slowly improving across the board, but math proficiency rates continue to lag behind ELA, as you can see in Exhibit 3 on page 9. Exhibits 4 and 5 on pages 10 and 11 show that there are also significant demographic gaps in test scores. DLS is recommending adopting committee narrative requesting a report on MCAP scores and progress on remediating pandemic-related learning loss. Page 12 discusses millions of dollars in transfers from MSDE's Aid to Ed budget to its headquarters budget in fiscal 25 and 26. One fiscal 25 closeout amendment transferred nearly $4 million in general funds between budgets, including $2 million from food services for free and reduced price meal recipients, $441,000 from child care scholarships, $425,000 from funding for children in out-of-county living arrangements, and $1.1 million from innovative programs. In innovative programs, the transferred savings came from 5 programs: the Ileana Leadership Foundation, the Healthy Families Initiative, student field trips, the Lacrosse Opportunities Grant Program, and the Adult High School Pilot Program. Another budget amendment for fiscal 26 would transfer an additional $6.5 million in special funds originally intended for Blueprint Transition grants and the College and Career Readiness Program to the headquarters budget. The realigned funds from both amendments are intended to supplement growing MCAP assessment contract costs, expert review teams, behavioral health training and grants, and personnel. DLS is concerned that MSDE is diverting savings from some programs providing services to children, including mandated aid programs, to expand administrative spending in the headquarters budget. This practice is detrimental to legislative oversight of the budget. MSDE should comment on the use of realignments to address shortfalls in the headquarters budget. Additionally, given the underutilization of several innovative programs leading to these transfers, DLS recommends reducing the appropriations for the Healthy Families Initiative, the Adult High School Pilot Program, the Student Field Trip Fund, and the Leading Men Fellowship to a level consistent with prior years and actual spending. DLS also recommends deleting funds in the fiscal 27 budget for the Ileana Leadership Foundation, which is no longer in operation. Page 14 begins the discussion of the fiscal 27 budget and the BRFA, which includes 4 provisions impacting the Aid to Ed budget. First, there's a provision that would reduce the state share of annual employer pension contributions for members of the teachers' retirement system and teachers' pension system employed by local school systems, community colleges, and libraries. The fiscal 27 budget includes a $36.2 million contingent reduction that would transfer half of the increase in the state's share of K-12 teacher retirement costs to local jurisdictions. Keeping consistent with recommendations made in the Aid to Community Colleges and Maryland State Library Agency budgets, DLS is recommending shifting 100% of the fiscal 27 increase in the state share of teacher retirement costs, or $72.4 million, to local jurisdictions. The second BRFA provision would repeal the requirement that $2 million in special funds from the uninsured motorist penalty fees be distributed to the Driver Education Fund annually. The fiscal 27 budget as introduced includes a $2 million contingent reduction related to this provision. The third provision eliminates the $40,000 mandate for the Lacrosse Opportunities Program, which received no applications in fiscal 25. The final provision prohibits the use of funds in fiscal 27 to provide rate increases for non-public placement providers above the rates in effect as of January 2026. The fiscal 27 budget as introduced includes a related $2.5 million general fund contingent reduction. Moving on to the rest of the budget, the fiscal 27 aid to ed allowance totals $11.1 billion, with general funds comprising $7.4 billion, or 67%. Exhibits 6 through 8 on pages 16 through 18 show the overview of agency spending by fund type and program. On page 19, Exhibit 9 shows a forecast of Blueprint costs by funding source. Beginning in fiscal 28, Blueprint fund revenues will not cover all eligible Blueprint program costs. The forecast anticipates a $1.7 billion gap in fiscal 28, which would be covered with general funds. The need for general funds grows to $2.3 billion in fiscal 29 and is projected to reach $3.4 billion in fiscal 31. Exhibit 11 on page 21 shows the proposed changes to aid to ed programs in the allowance. The biggest increases occur in formula-funded programs, with the exception of compensatory education, which decreases by $40.4 million. The allowance also contains a $10.9 million increase in general funds for the new Academic Excellence Program, which puts math and literacy coaches in classrooms. $9.3 million of the total program budget supports its administration. Because the aid to ed budget is solely meant for the distribution of grants and does not include the administrative expenses of other grant programs, DLS recommends adding language transferring the administration of the Academic Excellence Fund to the headquarters budget. Moving on to page 23, as you're probably aware, for each major aid program, there's a required state share and required local share. The maintenance of effort requirement establishes a floor to ensure that the local per pupil appropriation never drops below the amount provided in the previous year. This ensures that counties can't backtrack on their per pupil spending. Then, this floor is compared against the calculated local share of the program formulas. Counties are then legally obligated to pay whichever total is higher. In past years, this analysis has shown the local effort requirement. However, this year, the analysis does not provide specifics because of data discrepancies across various files shared by MSDE. DLS does not currently have a complete picture of the minimum funding requirements by county in fiscal 26 or the basis for calculating fiscal 27 local effort. For instance, MSDE appears not to have applied consistent logic across all 24 jurisdictions when determining the local effort requirement for pre-K or the Blueprint Coordinator program. MSDE should discuss issues with calculating local maintenance of effort, inconsistencies with communicating Blueprint Coordinator cost shares, and its current calculation process for determining local effort. MSDE should also discuss local effort guidance provided to counties and whether the agency will consider updating its local effort certification forms in order to prevent confusion in the future. Moving on to enrollment, full-time equivalent enrollment saw an overall decrease of approximately 7,400. This can be attributed to a declining birth rate, an increase in homeschooling, the impact of federal immigration policy, and a new method used to calculate compensatory education enrollment. Exhibits 12 and 13 on pages 24 and 26 show comp ed enrollment and free and reduced price meal counts, or FRPM. The comp ed program uses FRPM counts as a proxy for the number of economically disadvantaged students who need additional educational services. Comp ed enrollment fell by more than $41,000 from the previous 41,000 students from the previous year, There are a lot of components to this change, but a big driver is a statutory change to MSDE's comp ed calculation beginning in fiscal 27. In response to this change, the Accountability and Implementation Board proposed Senate Bill 311, which would extend the method used to calculate comp ed in prior years through fiscal 27, pushing the transition to the new calculation method to fiscal 28. The bill's other proposed revisions to the blueprint appear on page 27. MSDE should comment on whether a one-year extension of the calculation method just delays the enrollment count reductions by a year, or if the agency plans to take steps to increase the direct certification and eligibility counts at community eligibility provision schools. Exhibit 14 on page 29 shows changes to full-time enrollment, special ed, and multilingual learners. Special ed enrollment increased by 2%, and limited English proficient enrollment decreased by nearly 4%. Page 30 has a discussion of national board certification teacher counts, which I won't go into for the sake of time, but DLS is recommending adopting committee narrative requesting a report on free and reduced price meal enrollment, college and career readiness participation, and NBC teacher counts. The issue section begins on page 31 with a discussion of the status of the autism waiver program, which DLS believes has been misrepresented by MSDE. In September 2024, MSDE published a report describing ongoing efforts to expand the autism waiver program. MSDE then testified during the 2025 session that it would be able to serve 1,914 slots consistently in fiscal 26 and confirmed that these slots would be filled from the waiting list as participants vacate the program. However, the agency's November 2025 report contradicts these statements. The report indicated that no invitations to apply for services have been sent since November 2023. Furthermore, MSDE reported that it has not been backfilling the slots of individuals who age out of the program. Utilized slots decreased from 1,934 in fiscal 25 to 1,784 in fiscal 26, and will continue to decrease through fiscal 29 to an estimated 1,369. Exhibit 16 on page 33 compares the enrollment projections in MSDE's 2024 and 2025 JCR submissions. MSDE stated that the enrollment freeze is due to increased program costs resulting from still in effect policies implemented during the pandemic. These policies expanded service access and relaxed requirements for service providers, including allowing telehealth services and expanding billable hours for intensive individual support services from 25 to 40 hours per week. Family members also became eligible to receive payments for caretaking, which further increased costs. Exhibit 17 on page 34 shows total program costs from fiscal 23 to 27. Despite approximately $17.4 million in deficiency appropriations and transfers from the dedicated purpose account, fiscal 25 program costs still exceeded the amended budget by $16.9 million, but MSDE did not report this overspending to the Comptroller's office as required. MSDE should comment on why it did not report the shortfall at closeout and changes to processes to ensure shortfalls are properly reported moving forward. Between fiscal 25 and 26, total program costs increased by 5.2% and cost per slot increased by 14.1%. The fiscal 27 allowance includes $62.1 million in general funds for the autism waiver program, which is a 10.7% decrease from the year prior after accounting for deficiency appropriations. Page 35 lists the cost containment measures being implemented or considered by MSDE. MSDE should comment on why it did not notify the General Assembly prior to the November 2025 report that enrollment was frozen and the agency was seeking to decrease slots and implement cost containment measures. MSDE should discuss how the agency determined its cost containment measures and outreach efforts to notify participants of these measures. In addition, DLS recommends adopting committee narrative requesting an update on this program, including a timeline for the end of the enrollment freeze. Issue 2 begins on page 36 and discusses special ed enrollment growth. When the Kerwin Commission was developing the special ed funding formula, the Commission assumed that funding interventions in early childhood and early elementary school would lead to lower special education costs in the long run. This led to the expectation that, in the long term, special ed programs would primarily consist of students with more severe learning challenges. Therefore, per pupil funding for the formula would need to grow at a higher rate than other formulas, but the number of pupils would decline over time, lessening the impact of those higher per pupil costs. However, as of January 2026, the eventual reduction in special education enrollment and subsequent cost savings have not come to fruition. Exhibit 18 on page 37 compares the Kerwin Commission's expectation for enrollment to the updated forecast. Instead of declining, enrollment continues to trend steadily upward and grows by 2% in fiscal 27. The mandated growth rate for fiscal 27 through 30 ranges from 13.5% to 17.2% out of anticipation of an enrollment picture that is not current reality. In Exhibit 19 on page 38, you'll see the impact of DLS's recommendation to add a provision to the BRFA to reduce the expected growth rates for fiscal 27 through 30 to 5% annually. DLS also recommends a reduction of $58.5 million that is contingent on the enactment of a provision changing the per pupil funding level. Moving on to issue 3, Exhibit 20 on page 39 shows chronic absenteeism rates over the past 5 school years. MSDE and AIB set a 3-year target to reduce chronic absenteeism to 15% for the 25-26 school year. A quarter of students were chronically absent in the 24-25 school year, which means that chronic absenteeism would need to decrease by more than 10 percentage points in 1 year to meet the target. As you can see in Exhibit 21 on page 40, there are significant differences in chronic absenteeism rates between different student groups, with nearly 60% of homeless students reported as chronically absent. The bold language on the next page asks MSDE to discuss efforts to reduce chronic absenteeism and initiatives geared toward the student groups with the highest rates. Finally, issue 4 highlights unspent federal stimulus funds. For some background, LEAs received nearly $3 billion in federal stimulus during the pandemic, which had staggered spending deadlines. These funds were used to address learning loss and improve school health. Exhibits 22 and 23 on pages 42 and 43 show allocations and expenditures by county. As of December 2025, LEAs have spent 97.7% of the $2.72 billion in elementary and secondary school emergency relief funds, the last of which expire at the end of March 2026. Additionally, LEAs have spent 98.2% of the $265.3 million in Relief Act allocations. DLS would like to note that Montgomery County was the only LEA to not submit the required report on federal stimulus fund expenditures, so the analysis uses the county's data from the 2024 JCR. DLS recommends adding language.
Stop 1 second. So, but they did after that.
I'm getting there.
Okay.
Yes. So
right.
for some context, after the House hearing, we did receive the late report from Montgomery County, which stated that they have spent about 99% of their funds. At the time this report was written, though, DLS had not received this report, despite reminders. So DLS recommended adding language restricting $50,000 in general funds for Montgomery County Public Schools until the late reports were submitted.
We've been known to do that.
DLS also recommends committee narrative requiring all jurisdictions with remaining balances to submit a final closeout report on federal stimulus expenditures. Recommended actions appear on pages 44 through 50, and there are 2 updates on page 51 about the College and Career Readiness Program and education support professionals. That concludes my presentation, and I'm happy to answer any questions.
Thank you. A very thorough presentation, and I really, really appreciate it. Jack, Senator Bailey, any questions?
Well, I have a lot of questions, and I'd say I really do appreciate your report and the thoroughness of it. But the one thing that I, dealing with the local jurisdictions and trying to go back and tell them what's so important for them to fund, right? Because, we did sort of pull the rug out from underneath of them last year just a little bit. I am very curious about the fact that you made reference to when we deal with the 24 jurisdictions and we're talking about maintenance of effort, local effort, that there was there were different standards between different counties. And I'm very curious. I got everything going on here, and I'm just like, where is that? So if you could help me with that, just so we could, I could take a look at that.
Yes. You want me to direct you to the page number, first of all?
You could, yes, ma'am.
Okay. 1 moment. I believe it's page 23 of the analysis, and MSDE will be speaking to this, but essentially DLS received conflicting information about how standards were applied to LEAs. MSDE has since contacted us to clear that up, but it did not make it into the report. So they'll be speaking to that.
Okay, All right, well, I look for their response. Thank you very much.
Madam Secretary, do you want to come up to the table? Bring your team. All right. Welcome.
Welcome. Thank you. Thank you. Good afternoon, Madam Chair and members of the committee. I'm Carrie Wright, State Superintendent of Schools, and with me today is Krishna Tulur, who's our Chief Operating Officer, and Donna Gunning, who's our Chief Financial Officer. And I want to say thank you so much for all the work that you're doing. We so appreciate it and appreciate your partnership, and thank you for your analysis of our budget. When we met a few years ago, I told you that Maryland's support for public education is the envy of the nation. And that is due in large part to the partnership and collaboration of this body. I also told you about the progress in students' literacy and mathematics achievement, and this progress reflects a renewed focus on the instructional core, strong teaching, high-quality materials, and engaged students in classrooms across Maryland. We talked about the department's commitment to the Blueprint for Maryland's Future and our new strategic plan, Maryland Momentum, that is aligned to the pillars of the Blueprint. We have more work to do as we seek to capitalize on this sustained statewide progress, and we look forward to continuing these efforts through the partnership with the Governor and the General Assembly. With respect to the analysis, I will share some comments, and then I'm going to turn it over to Krishna Tulur, who's our Chief Operating Officer, who will share more details. First, I want to talk about special ed. The recommendation to adjust the per-pupil amount for special education program is understandable, given the state's fiscal situation. However, I think it's important to share some information on the impact of this change. One of the things that we wanted you to be aware of is that, as you know, the Blueprint required a study done, an adequacy study done of special education. That is underway. Part of that study, and it's a report that's going to be coming to you, I believe, in December, will give you more information around the status of special education and the status of special education spending across the state, more specifically, right down to the disability. We contracted with AIR, and they have already started collecting data and establishing programmatic protocols. This is coming to you, as I said, in December 15th. They've got a very tight timeline to evaluate funding levels, cost-sharing methodologies, and non-public placements. This comprehensive report should reveal the data that we need to make informed decisions on special education funding. Lastly, I'd like to talk about the Concentration of Poverty program and identifying students of economic disadvantage. There have been several studies conducted to determine the best way to identify children in poverty, and there are several options. Each has pros and cons, and neither produces more reliable results than the other. Therefore, we are left with a current proxy, which is eligibility for free and reduced price meals, which includes children directly certified through the participation in federal assistance programs like SNAP and TANF. Changes to the TANF program at the federal level, as well as other actions by the Trump administration, are causing a stark decrease in participation in federal assistance programs. This directly impacts Maryland's districts and students because it impacts funding for compensatory ed and concentration of poverty programs. Extending the hold harmless beyond 2027 is critical to meeting the needs of all students. I appreciate the opportunity to share our progress. I want to thank you for your commitment, and I'm going to turn it over to Krishna for further details.
Thank you, Dr. Wright, and good afternoon, Madam Chair, committee members. For the record, I am Krishna Tulur, Chief Operating Officer at MSDE. I will now share a summary of MSDE's response to the analysis. Regarding the DLS concern on diverting the savings from the programs to expand administrative funding, MSDE would like to clarify that the realignment from Aid to Education budget to the headquarters budget in the FY 2026 working budget amendment are necessary due to the administrative nature of the activities. These are not grant programs. MSDE believes these grants were incorrectly located in the Aid to Education budget in the prior years and is correcting them in the FY 2026 working amendments. MSDE also concurs with the analyst's recommendations to transfer the funds from Academic Excellence Program into MSD headquarters budget with regards to the administration of the program. Regarding,
Can I stop you right there? And I know there's some question about transferring funds and that kind of thing, and I think it might help in the future is if that kind of thing, because I know you're up against the wall as far as spreading the dollars around, but if you've got to make a major transfer, you can kind of just let us know ahead of time so that we can do this together and it's not a surprise and it'll keep you out of trouble. Just saying.
No, totally agree with that. Would it be, being new at this part of it, would it be to the chair?
To just, you can let the chair know or
Okay.
me, but just so that it's not a surprise at the end. We're just going to have to work together, I think, to
Okay,
get through
perfect.
this.
Thank you, Madam Chair. Next, we will move on to autism waiver. MSDE has worked with DBM and the Governor's Office to identify cost containment measures. The program's costs have increased on average 25% between fiscal 2021 and 2025. This is a result of pandemic-related changes in policy and practice through autism waiver managed by the Department of Health and Federal Centers for Medicaid and Medicare. These changes included revised provider qualification requirements and making telehealth an allowable service delivery model. These two changes enabled waiver participants to access more services sooner and more often than they would have been available pre-pandemic. MSD is working through a list of program changes that can be implemented quickly without a negative impact on waiver participants. These include requiring a level of care plan, which needs assessment, linked to an individual's plan of care, and requiring service providers to clock in and out. Other cost savings measures require amendments to autism waiver through Centers for Medicaid and Medicare. Regarding the maintenance of effort, the issues with the maintenance of effort calculations are in the process of being resolved. The blueprint coordinators are now included in the required local share, and reconciling the local share of the private pre-kindergarten programs paid by the counties has been shared with DLS analysts, and it will be shared with MACO and PZAM once resolved. MSDE concurs with regarding the other recommendations, MSDE concurs with the reduction to the Ileana Leadership Foundation and respectfully disagrees with the remaining program reductions. The actual expenditures reported in fiscal 2025 for the Healthy Families Program does not include encumbrances or obligations incurred by the program.
Can I stop you 1 second there? Senator Bailey has a question.
Sure.
Before you get any further, let's go back to that answer for the local share and maintenance of effort, and just explain that to me, how it happened that we had different standards, and what the practicality is that now all 24 jurisdictions are going to have the same standard, and that we're going to be able to know what that is.
Do you want to take that down?
First of all, I'm not sure I understand what the different standards are. The calculation is the calculation, and the LEAs or local governments have not been held to any different standard. There has been an issue with including funding for the blueprint coordinator.
So did I misunderstand that?
So we're talking about calculating the local share for the upcoming fiscal year. In past years, DLS is not saying that different local jurisdictions have been held to different standards. We're saying that in our collaboration with MSD to understand the local picture for fiscal 27,
Right.
our fiscal notes team in particular identified some inconsistencies with the logic for calculating, which we are now working out with MSD.
Can you be more specific about that?
I'm going to have to speak to Scott Gates about this, but I believe Donna has had a back and forth with him.
Not about that. Not about 27.
Not about 27?
No.
You mean with 26?
We have had a back and forth about finalizing this solution for the private pre-K providers. I don't know the reference to fiscal notes. I'm not sure what.
I'm speaking about how our team is mostly comprised of fiscal note writers. So Scott Gates, for example, so he mostly handles those calculations. So I would need to touch base with him.
Okay.
Yeah, I just want to reiterate what Donna said, and to your point, Senator Bailey, we don't treat the counties differently. The calculations are the calculations. So however that is, and I'm not the calculator, so I can't speak to that, Donna is, but all districts are treated the same way with the same level of calculation. It's not like we're treating Cecil County differently than we're treating Prince George's County. However the calculations are run, and Donna can explain to you how they're run, all districts are treated the same.
I just want to be clear that I appreciate everything that you do. I know everybody here is hardworking, right? And I respect everybody's position, and I respect yours too. But I do know that when I listened to this report and what I have read, up to this point, I have some genuine concerns, right, about us moving money, about us switching things without coming back to the General Assembly.
Totally understand.
To say this.
Totally
And then when I heard what the analyst said, and I understand calculations, as you all know, my wife is a financial wizard, right? And I do know, as I said earlier, that when we're dealing with the local counties, the way that their percentages have changed based on things we've done in the General Assembly, or the way that some of their percentages have changed versus how we had told them it was going to be, right? This is in a rural county with not a lot of money. This is really a big deal for us, right? And so, so clearly, right, I would like to drill down on this. So that we know and I understand, so that not just, and it's not that I don't believe you all, but you would not believe what some people come in here and tell us, So I just want to drill down so that we make sure that for our constituents out there, that we're using the absolute best use of their taxpayer dollars when it comes to what we're providing for education.
Totally agree. Would you like us to arrange a time, individual time with Donna Gunning to kind of go over those calculations?
So I absolutely think that this should be something, I know Senator Cortman is able to be here today, but I mean, maybe we could do a little further. We can definitely all, but I think we should all be involved in this process.
That's fine. We're more than happy to do whatever it is that you want, Madam Chair. I mean, if you would like us to arrange a time for Donna, and I to come down to kind of go over how the calculations are done so that you can see for yourself exactly how that happens, we're more than happy to do that.
We could do that. Is that what you're thinking is necessary?
I'm happy to do that.
Okay. I mean, I guess that's probably what we need to do.
Okay.
Yeah.
Okay.
Thank
I
you,
just
Madam
want to
Chair.
add one thing real quick. So I think the reason why the analyst is using the term standards and that they're different is that what we are working on with Scott Gates right now is correcting an issue in prior years. So if we're going to correct the issue permanently, we're going to correct some one way and some another way, right? It's a both ways process. And if that's the only thing I can think of that they are referring to as different standards, but it is not in how the maintenance of effort is calculated.
Right, but going forward,
it's there.
Going forward,
this is a
they're all
one-time solution.
the same
And
standards.
it's done. Correct. The calculations are based on the same standards. This correction of a prior year issue it's not different standards. Everybody's held to the same standards. Some have an increase, some have a decrease.
Okay, I'm okay with that.
Okay.
Great.
Yes, Senator Bailey, Mayor.
Yes.
All right.
And I'm very sorry, too.
No,
Not
no,
at
no,
all.
no,
Thank
don't
you.
apologize.
But I did want you to go through and then we go back.
No, absolutely.
Thank
Ask
you.
away.
So let me restart with the response to the, not at all, Madam Chair, thank you, with the recommended reductions. MSDE concurs with the reductions to the Ileana Leadership Foundation and respectfully disagrees with the remaining program reductions. The actual expenditures reported in fiscal 2025 for the Healthy Families program does not include encumbrances or obligations incurred by the program. Both the adult high school pilot and the student field trip programs did not utilize all of their fiscal 2025 funding, but have used their fiscal 2026 funding. The adult high school pilot has plans to expand programming through Department of Labor. The student trip program, student field trip program began in fiscal 2025. Utilization of these funds got off to a slow start, but will be fully utilized in fiscal 2026. The Leading Men Fellowship Program provides direct services to students in the Black school districts. This program also provides strong role models for children and grows the teaching profession by encouraging fellows to pursue certification. Reducing these programs' fiscal 2027 appropriation would halt important work that is benefiting students and families across the state. Department concurs with the recommended reports. With respect to recommendations for LEAs, MSDE will follow legislature's guidance. MSDE has respectfully submitted the detailed written response to the analysis, and with that, we stand here ready for questions. Thank you.
Thank you. I do have a question. We've talked in a couple meetings lately about math scores. Can you talk a little bit about that and what we're dealing with?
Yeah, I sure can. In the past, so let me back up. The math test that's current was changed 3 different times in 3 different years. And that should never have happened, to be very
And
blunt.
it's a big complaint from teachers.
Big
that I've
time,
talked
as
to.
well it should be. And I've been very upfront about that. What we did not have in place, that every state has in place, is what we refer to as a technical advisory committee. This is a group of psychometricians that is their job to oversee the development and implementation of assessments, statewide assessment systems, and statewide accountability systems. Maryland's has not been in play for a decade. So one of the first questions I asked when I found all these questions were coming up, and quite honestly, when I got here, Chairwoman, people were coming to me directly saying, something's wrong with the assessment, something's wrong with the assessment. It's not reflecting what we think our children are showing. So I put together a very large and diverse task force to look at our assessment and our accountability system, and our accountability system is commonly referred to as the report card, Maryland's report card. So for the past 20 months, we have been working on this, and our vendor for the statewide assessment was expiring in December of 26 anyway, so we put out an RFP for a brand new assessment, and NCS Pearson won that and was approved at BPW. When we had the technical advisory committee in play, they started digging into our assessment because I said, okay, take a look at the assessment because I'm hearing that something is amiss. And yes, indeed, that is what they found, the math assessment. If you want to try and give you a visual, if you look at a bell-shaped curve and you think of that as all the items on a math test, and you right down the middle, you kind of expect on both sides of a standard deviation of right down the middle where most of the questions are going to occur, and it should look in a graph pretty much like a bell-shaped curve. When the technical advisory committee was digging into the math assessment to visualize it, take this bell-shaped curve, so you go from the easy questions to the harder questions, take that and shift it to the left, meaning the easy questions started in a hard spot to begin with and then got harder. So that is the beauty of what we're getting ready to do now, that we have a technical advisory committee. We have revised all of our standards. So now we can hand off to the vendor the most current standards, and we have a technical advisory committee, members of which include someone with a specialty in multilingual learners, somebody with a specialty in students with disabilities, but these are nationally known experts in the field. And so as we are now developing this, we have the ability now to make sure that this never happens again, and we can assure the field that it's aligned to the standards and it is reliable and it is valid. So that, I suspect you're going to see a difference in our math scores. That would be my guess. We are administering the new assessment starting next year in the 26-27 school year. That will become our baseline year. And then there's a process by where you go back in and put cut scores to know whether you're advanced or proficient or basic, that kind of thing. We can't do that until the summer because we need a large enough number of students who've taken the test to do that. It's called standard setting. It's a research-based process. So at that time, Maryland teachers at each grade level will pull in a group of teachers for third grade and fourth grade, et cetera, to then take a look at the test and the results of the test and the items that are on the test to say, where should a cut score be for a third grader that's proficient, let's say? And then we cut those differently. And then we'll rerun all of those results to go back to the districts, because when they first get their results, they're not going to, they'll have a scale score, but they won't know what that equates to until the standard setting is done. And then once the standard setting is done, we can rerun those assessments with those cuts, and then they'll know for sure how many kids are advanced, how many kids are proficient, how many kids are basic, et cetera. So that's kind of the overall process.
Okay. The thing that's running through my mind as you're saying that is trying to explain that in a way to the public
Yes.
that they don't think we are making the test easier.
No, we are not. No.
But it's going to
Yeah.
have to be explained
Yeah.
somehow so that that's not what they understand.
Absolutely. And we're working on a comms plan as well, because I think it's going to be important, because once you get even the student report that comes back, the individual student report, we need that in plain language so that parents know
Yes.
exactly, how their children are performing, and the community knows very plainly how their schools are performing. So that is something
that's the thing that I hear from parents all the time. If we can, and we've got pretty educated parents too.
Yes, you do.
If we can put it in wording that explains to them exactly what their kids are learning and what the expectations are, I think we'd have a whole lot less complaints about what we're doing, because people need to understand.
I agree. Couldn't agree more.
Senator Bailey.
Thank you, Madam Chair. And I wanted to just ask a couple of questions
Sure.
about this, and I want to say how much I appreciate your answer. Remember, it was the chair and some other members of this committee a few years ago when you first came, right? That we were trying to tell you that there were some problems with these tests.
You
Now,
were.
you had a team that was telling you there was no problems, but being on the front lines, we were like,
Yep.
wait a minute, we really have some issues. So I appreciate the fact that there's been some acknowledgement of that. But when I've been out there in the schools and I run into the teachers, the biggest question that they had was, we don't know what the rubric is. So we don't know what, the direction that we're teaching. I might be teaching a little different than, another school, right? And so if we don't know what the test is, we don't know anything. We don't know, how to know that we're teaching the right things and how we're moving at the right direction. And is that now being addressed, that we are actually, I think that, from being and taught a few classes, I know that we don't just want to teach to a test.
No, there's no point in teaching to a
There's no
test.
point in just teaching to a test. But at least if the teachers know the area and the timeline and what they're supposed to be teaching, then we know that is, that really, and to me, increases the validity of the student's knowledge.
So a simple answer to that is this. The thing that I will tell teachers again and again, simply teach the standards that's in front of them, the grade level standards. So you're going to have language arts, third grade level standards. You're going to have math, third grade level standards. You're going to have social studies or science, third grade level standards. The same is true for whatever grade is being taught with whatever subject is being taught. Okay. So if you do nothing else than teach the standards, the test will take care of itself. Because what's on the test is what's going to be measured are the standards and the student's mastery or lack thereof of those standards.
So So what you're saying is that now the standards that are being taught are going to more align to the test that,
They're going to totally align to the assessment.
okay. That was a big question
Yep.
that we had because, you know, and a lot of teachers, I think in the system had that question
They
too.
did, they
Yeah,
did.
so I'm glad of that now. And my next question is.
Sure.
Who takes the test?
Federally required is 3rd through 8th grade, both in ELA and math, and then again in high school in 10th grade, 10th grade. There's an English test, a math test, and a science test.
So
And we have a
does-
social studies test as well.
So does that mean that every student in a public school, they would take the test?
That's exactly correct.
Does it mean that any student in Maryland in a parochial school would take the test?
That's up to them. That is strictly up to them.
private school?
A private school, that's up to them.
Okay. How about the children that are homeschooled? Would they take the test?
That would be up to a parent if they decided to have that done. Typically, they usually have their own curriculum that they're working from at home.
Okay, so even though we talk about education across the board for Maryland, we're only, you know, we're only talking about the
Public schools.
The public schools, children. Okay.
That's all I've got purview over,
Yeah,
is
yeah,
pre-K through grade 12.
I know, I just wanted to make
Absolutely.
sure to see
And
if
that
there was
includes your
any other, any other thing. Is there anyone else that's included? in
Public
that?
charters are included in
The
that.
public
So public
charters?
charters have to
Well,
take
they're-
our assessment.
They're public schools.
They're public schools, that's right.
Okay. My significant other points that out to me, as we all know. Okay. All right, that's it. Thank you.
Okay, you're
Thank you.
welcome. You're welcome.
The only other thing I wanted to talk to you about a little bit, just talk to me about the autism waiver.
Is there something specific that you wanted us to talk about?
No, not specific, I guess. What was it you wanted?
Why don't we give, Madam Chair, would you like us to give you just like a little bit of a background on where
Yeah.
we are, and which will also address some of the comments from the
Yes.
analyst?
Yes,
Okay,
please.
Donna.
Okay, so the background on autism waiver is that during the pandemic, there were a number of policies that were relaxed, if you will, that allowed
I remember that.
that allowed families access to more services and more time or more of those services. And all of that increased cost. The other waiver that happened was for a provider of service. There, pre-pandemic, there were pretty strict requirements on what someone had to be able to know and do to be considered a provider. A lot of those were relaxed during the pandemic. Post-pandemic, those changes were not reversed, right? So you have costs steadily increasing. At the same time, in '23, we had the end the wait work that added additional slots to the autism waiver so that more participants would have access to those services. As that grew, the cost, the magnification of the cost was something that set everybody back a little bit, like trying to figure out what is driving these increased costs. So when we were here in '25, we were serving at that point 1,934 individuals on the autism waiver. And the plan was that we were going to try and hold steady and backfill as folks left aged out or voluntarily left the autism waiver. When we got to the fall, as we had, by that time, we would have had our full invoice from Department of Health for that whole year, and those costs are still growing exponentially. And at that time, we felt it was in the best interest of the economics of the state to hold tight until we could work with DBM and the governor's office to identify options for controlling cost with the least impact on participants, right? We don't want to decline, we don't want to make a service ineligible, but there are ways that we can provide those services that are more cost-effective. So that was the plan. Per your point earlier, was that clearly communicated to you all here? Probably not. We own that. However, that's where we are right now. Is that helpful? Yes. Okay.
Okay, Senator Bailey, anything else?
So I do have just a couple of quick questions.
Okay.
And they come from some of the audits that were performed this year, and so just bear with me. I want to talk about safety when we're hiring employees. You familiar with that part of the audit? Yeah.
Background checks?
Background checks, things of that, and I don't think you responded to that question, did you?
In our response?
Yes.
I don't know that we were asked.
Yeah, I don't know that we asked that, but I'm gonna.
Previous analysis.
Okay,
Oh, I started to say,
It was in headquarters analysis. We responded to it in our headquarters.
so that's coming, that,
We already did.
We already discussed.
yeah.
okay, all right, then I will, well, I'm just curious, have we fixed,
What exactly was, can you repeat the finding? That would help me a little bit.
I can give some background from memory if you need.
I think,
Is this from last year?
It's from this year's
Just this year,
MSD
but
headquarters.
looking back.
Yes,
Yes.
the audit was, I believe, 2021 to 2024.
Yes.
And I believe finding one or two related to oversight of LEAs conducting background checks.
Okay.
yeah.
That, can I, yeah,
Yeah, I just found it. It says that it was worried about the policies and procedures to ensure that employees hired by LEAs were properly screened and did not have past disciplinary action that precluded employment to the work with children.
So the way-
And I'm sorry that I didn't
Sorry.
bring this up earlier, but
That's okay.
but as I was reading it, I was like, holy smokes, this is potentially a safety thing. I want to just make sure that we've addressed it. You weren't here. So sometimes.
Well, I think most of the school systems have gone back and doubled down on it now across
I
the
do
state.
too.
Okay.
Yeah.
That's an issue that we tried to explain to OLA when they were here. We do not have oversight of the LEA's background check processes. There have been, and you're right, Madam Chair, there have been a number of LEAs, once they have found some things that have happened inside the system, that have really, to use your term, they have doubled down on trying to make this a far safer process. We tried to explain to OLA that we don't oversee that. What we do is we do a percentage audit, let's say, per year, to see, what we can find, but with the thousands and thousands of licenses, that's really the reason that it is at the
local
LEAs.
issue. Yeah.
Now, some states do it centrally in the agency, but I can tell you that when I was in Mississippi, we had that centrally so that the agency was responsible for it. But for us to do that with this agency, we would probably need a team of 20 to 25 additional people in order to do that. So that's the reason it has stayed at the LEAs.
So let me ask you this question. The certification to be a teacher.
That comes
and to
through
make-
us.
Okay. So if we're certifying that they have the right education to be in the classroom, it doesn't seem like it would be that big of an issue to certify that they have a background.
No, there's a lot of work that goes into background checks. So the licensing, that's our role, which is, are you certified to teach or not? But then it's on the LEAs then to do the background checks to make sure that there is not a reason to not hire them, or there is a reason to not hire them. But that's not what the agency is responsible for. Yeah, go ahead.
Senator Bailey, to add to Dr. Wright's point, for that particular audit finding, there were two parts to the finding. The 1A, where auditors recommended that we establish procedures to ensure, at least on a test basis, that required pre-employment screenings were performed for applicants before being hired. MSDE has committed to providing guidance and policies to LEAs, and we are in the process of working through that, and we are going to provide the guidelines to ensure the best practices and what LEAs can do. The second part of the recommendation asked MSDE to mandate that LEAs sign up for what is called the Federal Wrap Back program that provides continuous updates to the files. And we clarified with the auditors that MSDE does not have the authority to mandate LEAs to sign up for the Wrap Back program. So those are the two parts as we identified, and that those type of authorities typically lie with the public safety and not with MSDE. However, for the first part, we are working on providing guidance and creating policies for LEAs.
I appreciate and I thank you both for your answer, but I would say that, you know, I'm a sportsman, right? We buy firearms all the time. If I walked in to buy one, I put my information down on a sheet in the state of Maryland. They dial a 1-800 number, and it comes back that says that I'm clear, right?
Are you sure?
So far, and I can walk right out of the store, right? It's not a big, extensive thing. There's a database that nationally that doesn't matter what state I'm in, right? I don't think it would be that difficult to have a form and to be able to manage it statewide. If we manage somebody's education, right, to say, hey, you've got to be certified to be in here, I think we could easily work to manage to make sure that we don't have somebody in that criminal realm that's in that classroom with our children. Just my opinion. We can work offline on that.
That's an issue for another day.
It is, but I appreciate your time. Thank you.
Thank you. I think that's all we have for you today.
Okay.
Can you be around for just a couple minutes? I have two witnesses here, but I just
Sure
wanted to.
can, absolutely.
Okay. Thank you
Thank
very
you.
much.
Thank you.
Okay, we have, is it Pia Morrison? Pia, come on up.
It's her birthday.
And Raya Gupta?
Ria, yeah.
Ria, okay. I'm batting 1,000 here.
Right.
Did you want to testify? Is there anybody else that needs to testify? Okay, we're all good. You're all good. Okay, go ahead.
Thank you for having me here this afternoon. Honorable Chairwoman King and members of the subcommittee. SEIU Local 500 represents over 23,000 workers, including several thousand educational support professionals in Montgomery County Public Schools. Our members are seeing firsthand the impact that recent federal policies, from workforce layoffs to immigration pressures, are having on our school communities. We know it will take action from this General Assembly and the governor to help stabilize these impacts. We commend Governor Westmore for proposing a historic $10.2 billion investment in K-12 education for FY 2027. That commitment matters, but we must also address a growing challenge: enrollment declines that are driven by forces outside of local school district control. In Montgomery County, the state's largest district, enrollment has dropped to about 156,000 students, down roughly 2,600 from last year, and projections show continued declines in the years ahead. International student enrollment has fallen sharply as well. Because state aid is tied to enrollment, these losses translate directly into funding cuts, even though districts have no control over the federal and economic forces driving families out. Without hold harmless protections, schools risk losing staff, programs, and student supports at the very moment that communities need the stability most. We urge you to fully fund MSDE's aid to education, adopt protections to shield districts from enrollment drops caused by federal actions, and ensure funding formulas that reflect real school and community needs. Stable school funding is about protecting students, supporting educators and staff, and preserving strong public schools across Maryland. Thank you so much for your time and consideration.
Thank you so much. And that is something that we're looking at. I mean, the world has been kind of turned upside down, and so we've got to roll with it. So we're looking at that. Okay, go ahead.
Good afternoon, Chair King and Senator Bailey. My name is Ria Gupta. I'm here on behalf of the Blueprint Coalition as well as Strong Schools Maryland in support of the Aid to Education budget with a few considerations that I hope to get to in the 2 minutes allotted to me. First is compensatory education. The budget reflects a $40.4 million decrease in compensatory education funding. At the same time, federal changes to Medicaid and SNAP, along with immigration enforcement, are creating fear in immigrant communities that will destabilize direct certification and how we count students living in poverty. We have to move past these unstable methods to determine school funding. We, of course, support extending the current grader of methodology in the short term, but to be clear, that is like the bare minimum. We need a more stable, transparent methodology that is resilient to federal policy shifts. Second, special education. The recommendation to cap special education funding growth at 5% is deeply concerning. Enrollment has not declined like previously assumed, but need and costs are rising, and districts are already supplementing special education services and with other funds just to meet legal obligations. And as the superintendent mentioned, there is a Students with Disabilities cost study underway. Cutting growth before that analysis is complete is premature and undermines the purpose of the blueprint. Students with disabilities continue to face some of the largest proficiency and attendance gaps in the state, and this is not the moment to flatten investments. And third, quick note, if you allow me, is on pre-kindergarten, because I will not be at Monday's early childhood hearing, unfortunately. You will hear the DLS recommendation to pause the expansion of Tier 2 for fiscal year 27, and I want to be clear that that will have extremely detrimental impacts, specifically on students with disabilities and multilingual learners, if this legislature doesn't make a legislative shift this session. Tier 1 eligibility of these students will sunset at the end of fiscal year 26 and will pull back support for more than around 2,000 students meant to be prioritized within the blueprint. Kindergarten readiness assessment shows persistent gaps for students with disabilities and multilingual learners, and we urge the inclusion of students with disabilities and multilingual learners in Tier 1 indefinitely.
Thank you very
Thank
much.
you.
That's something that we're wrestling with. We've got low dollars to spend and putting it in the best places that we can possibly. That's what we're wrestling with right now. So we won't always agree on exactly what is the most important, but we're wrestling with it, and we're going to put those dollars where they're spent the best. So thank you.
Thank you so much.
Thank you.
Thank you.
This ends the hearing for this afternoon. Thank you very much. Have a nice weekend. Thank you.